Yeah, so I think the first thing when we talk about diagnosis for gastric ulcers are what are the clinical signs, or we would say symptoms or clinical signs that the horse presents with. And historically, we've thought of things like weight loss, poor appetite, and we certainly still associate those with squamous disease. But as we see glandular disease gets more important and we sort of work more closely with our horses in some ways, we recognize a lot more the primary presentation is behavioral. Horses are presenting for behavioral change typically and undesirable behavior. So we really avoid the term bad behavior because it implies that there's sort of an intention from the horse to be bad or naughty. And so we recognize it as undesirable behavior, because what we know is if you look at that behavior, a lot of that behavior can be or is commonly pain driven. And that can be gastric ulcers, it can be musculoskeletal disease, it can be saddle fit, it can be any number of different things. But what we recognize is when we identify the pain, remove the pain, often the behavior improves dramatically as well. So horse wasn't trying to be naughty. It was its language of discomfort is just undesirable behavior and doing things that we don't necessarily like, especially under saddle. And so from that point, when we recognize those behavioral changes, it's really important that we pin down to an accurate diagnosis. And so most commonly, that's going to involve gastroscopy and looking inside the horse's stomach to confirm, first of all, that gastric ulcers are there, because we know that our musculoskeletal disease, our saddle fits, they can mimic exactly the same behavior presentations. So we want to make sure before we go and invest in time and money and resources into treating the condition that it's actually there. And the second is it allows us really useful information between distinguishing squamous disease from glandular disease. And that's really valuable because it has some treatment implications, but particularly because it has long-term prevention implications. And, we can, long list of things we can do to reduce the risk of disease, but the more targeted and nuanced we can be, the more likely we are to get a result, and the easier we make it for the owner. If we say, instead of here's a list of 10 things, of those 10 things, these 3 things are the best things that are going to give you the most value for effort in your horse. So a lot of value in gastroscopy beyond just confirming. And then obviously from there, that sets our treatment plans and we go from there.